Your kidneys filter your entire blood volume. It's about every 5 to 7 minutes.
They filter the blood and create urine, and that's one of our most important physiologic processes for removing toxins from the body.
And these are concentrated and drained through the ureter into the urinary bladder and finally expelled from the body.
Your kidney is somewhat like your hand. The calyces are identified by the tips of your fingers, and the renal papilla is actually inverts itself at the tip of each calyx.
The calyces, depending on their size, you can have the minor calyces, and as those calyces start to merge together, will form slightly larger cups called the major calyces before they all merge together into the renal pelvis.
And that's where all the urine pools, and once it reaches a certain tipping point, that's when the urine goes down the ureter.
The most important factor in the formation and propagation of renal stones is the concentration of the constituent stone material in urine, such that the constituent material becomes insoluble in urine and a stone forms.
If you have a very concentrated urine, which means that your urine is more of a yellow color or amber, when your urine gets concentrated like that, as you go back to just basic chemistry, you start to see certain items will start to precipitate out of that concentrated urine and form crystals.
The number one cause for stones is dehydration, because the more concentrated your urine is, the more of these solutes that you have, and they're closer together. So that's why people who don't drink enough water are at higher risk for forming stones.
The crystals are what form the calculus. A calculus is also the name for a kidney stone. Kidney stones usually form off of the renal papilla. So what happens at the end of the renal papilla is you'll develop a plaque, and that plaque has a calcium deposit on it. And from there, it creates the quote-unquote nidus for stone formation. And then that little area that's been a calcium deposit initially will turn into a stone.
It's when the stone decides to move down the ureter, that's when we start seeing symptoms. And the symptoms are caused by both the mechanical nature of the stone moving down that narrow tube, as well as causing kind of a roadblock for urine passing down to the bladder. And so you start getting the kidney swelling. That's when you really start getting the pain. From the kidney, right outside the kidney is the UPJ, or the ureteropelvic junction. A lot of stones get captured there because it goes from very wide to narrow quickly. If it's able to pass that, typically they can get all the way down to the bladder, but they can get stuck the entire way around, depending on size, shape, and then personal anatomy of the patient as well.
There are 4 major types of renal calculi or renal stones. The most common is calcium stones. These are typically stones composed of calcium oxalate and calcium phosphate. There are also struvite stones, and these are composed of magnesium, ammonium, and phosphate. There are uric acid stones, and also stones composed of the amino acid cysteine.
So very first thing, we get a urinalysis on most folks. You'll likely see microscopic blood on the urinalysis, and then definitely a CT scan, because that way we can evaluate the entire urinary tract from the kidneys down, find the position of the stone, and find the size of the stone as well, measure it.
I carefully interrogate and study the anatomy of the renal collecting systems, the kidneys, the renal pelvis, the ureters, and then where the ureters meet the urinary bladder and the urinary bladder itself, looking for all of the different potential pathologic findings, anatomic findings that I might see on a scan that might explain these patients' symptoms.
This is the size stone that a lot of times will not make it all the way out of the urinary tract. But most stones can be a lot smaller than this. They're usually the size of a tip of a pen. Those are the most common size stones, and those will typically pass within a couple of hours for patients.
So if we have a patient that we feel is going to be able to pass their stone on their own, we give them pain medication to control their pain. We give them an alpha blocker to help relax their urinary tract. And then we also give them medication for nausea. Some folks are vomiting and having issues with keeping food down. And so we like to control pain, nauseousness, and then help pass a stone.
The larger they are, the harder it is for them to sort of pass naturally. The more likely it is that Dr. Trotter or another urology specialist is going to have to do some type of invasive procedure or more extensive procedure to either retrieve it or break it up to help it along.
Treatment also is based off of where the stone is located. And so if the stone is in the upper part of the kidney or in the renal pelvis or in the upper part of the ureter, you can do what's called extracorporeal shockwave lithotripsy.
From outside the body, we send ultrasound shocks to the stone, break up the stone, and then the patient actually passes fragments or dust.
For stones that are in the lower part of the ureter, down near the bladder, or even in the mid to lower ureter, the shock waves are much less effective because the ureter is much narrower in that area and there's no room for the stone to expand and break up.
You can do what's called a ureteroscopy, where you send in a scope through the penis or urethra into the bladder, up the ureter, and visualize the stone and break it up with either a laser or just grab the stone and take it out.
The third way that you can manage stones is called percutaneous nephrolithotomy.
To actually go from the back straight into the kidney, and that way you can get more of the stone burden out of there.
It's a much more invasive way because you're actually going through the kidney itself, through the skin. There's actually a small incision to do it, but it's also a very effective way to remove big stones. The best ways to prevent kidney stones, absolutely number one, is to stay hydrated. And don't ever get yourself into that state where your urine is a very concentrated level. Prevention is hands down the best way to keep you from having another stone.